welcome to Glowing Through It. This is an opportunity to talk about skincare in perimenopause and beyond, which is a subject that I talk about every day in my clinic with my patients. And I'm so thrilled to share everything that I'm learning and continue to learn with you guys. Just a disclaimer, this webinar is not a substitute for medical care with your provider. So anything that I'm saying today, please take notes, write down your questions, reach out to me, reach out to your other healthcare providers who can help you get the care that you need. So let's get started. Why is a dermatologist talking to me about perimenopause and hormones? So I wanted to share a little bit about my story. In my teen years, hormones became my first love and frustration in medicine when I was diagnosed with type 1 diabetes, which really helped me learn a lot about the intricate nature of hormone interactions in the body and how they have such a vast impact. Then I spent my 20s basically praying my birth control worked and I wouldn't get pregnant, and I spent my 30s praying that I could get pregnant. I had some fertility struggles, irregular cycles, over and over again, just told, oh, it's because you're autoimmune, like that should be my middle name. Finally had 2 wonderful children, and now 3 doodles, and now I'm in my 40s, not feeling like myself, which we'll talk about, a phase of chaos as perimenopause has been described, with 3 dogs, 2 kids, and a busy medical practice. And over the past few years, I've just experienced this litany of symptoms, from insomnia to palpitations, frozen shoulder, horrible menstrual cycles, anxiety, dry eyes. I've seen numbers of specialists, had lots of lab tests and imaging done just to be told everything's normal. And that's really, really frustrating. So I've been there. And despite all of these workups and evaluations, not once has anyone mentioned that all of this could be perimenopause. And so I've taken a deeper dive. Professionally, why am I talking to you about this? Well, in my clinical life, I just started to ask the question, why? Why am I seeing so many adult female patients who are struggling with inflammatory skin conditions like rosacea, hormonal acne, dermatitis, all getting worse or even starting in their 40s? Why do women age so much more abruptly than men? Why can a man just kind of coast along for decades, but a woman hits her mid-40s and all of a sudden, boom, it's like our face drops, the bottom falls out, literally. Why is that? Why are so many of my female patients seeing so many specialists for multi-system complaints, not getting any good answers, and then turning to these alternative healthcare sources, which there's a role for them, and there's a reason they're thriving and existing right now, like functional medicine for health. What are we not providing as medical doctors that women are looking for? And then why are patients learning more about perimenopause from their Instagram feed than from their doctors? And how can I help change that for my patients? And so here we are today in kind of the kickoff of this journey for me professionally and with you all. So thank you for being here. So in this webinar, I'm going to cover a lot, probably too much. And if I don't get to anything, there will be follow-up webinars to this. First of all, I want us to understand the signs and symptoms of perimenopause, which are numerous and many. Breaking into that, why am I not feeling and looking like myself? What do those phrases mean, and what can we do about them? Understanding the hormone changes, understand what is estrogen, what does it do for me, and when it starts to drop, why it's impacting how you look and feel. Skincare, we're going to get into the basics. What do you need to navigate this time of life with or without hormones to protect, restore, and repair your skin? What treatments can we use to rebuild that structure that we're losing? And then how does hormone therapy play a role in all of this, whether it's local or systemic? We're going to talk about that too. And as an integrative dermatologist, I can't do a webinar without talking a little about important nutritional and lifestyle practices. So my goal at the end of this is for you to understand more about hormone health, what hormones do for you, what happens when we start to shift and experience changes in those levels, and then provide you with tools to glow forward and have an actionable plan, and at least know maybe what new questions you want to talk with your doctors about. So the menopause industry is booming, and this is, ultimately, I think this is good news, because this is a conversation that basically died in 2002 with the Women's Health Initiative. And now with the newer, better interpretation of all of the data and more studies that are being done, hormone therapy is back on the table, and women are talking about it. We're talking about it, we're doing things about it. So this is empowering. It's empowering because we have options. It's empowering because we are not just told that we have to suffer through it, and this is a normal phase of life. So I think ultimately it's a good thing. But these photos was from a 30-second scroll on my Instagram. Menopause is everywhere, and I'm sorry, it'll probably be all over your Instagram feed at the end of this if it isn't already, but it's not necessarily a bad thing. The issue, though, is that it's an opportunity for a lot of money grabs, and we have to be savvy consumers, and we have to be responsible medical providers. Like, you don't need a fiber supplement that's labeled menopause. You don't need to pay up for that, just like you don't need Aquaphor ointment that's labeled baby. Like, the branding of this is, exploitative, and we're trying to stay away from that. So just make sure you're a smart consumer. You look at the science behind what's being sold to you, and you do talk to providers who actually know and understand the science of menopause, so you get the help that you need. Your health is always in style, but your health is not a trend. So let's look at some hormone charts. So as we go through this journey, you'll see that in premenopause, you have this fluctuating but more regularly fluctuating pattern of estrogen, progesterone, FSH, and luteinizing hormone. Then you hit perimenopause. And perimenopause is absolutely when things sort of get a little wacky. It's a chaotic phase. The fluctuations are less regular and less turbulent. And then in postmenopause, please look at the green line. That's your estrogen. It flatlines. It doesn't go to zero. Your ovarian production does, but you are still getting estrogen from some other sources, including your skin. But it really takes a dive and it stays flat. So what is perimenopause? It's just the time marked by these fluctuating hormone changes leading up to menopause. It's diagnosed by signs and symptoms, not tests. Look at that perimenopause curve. Depending on what day you have these tests done and what month you have them done, you could have either a totally normal estradiol level or a really low estradiol level, or you could have a high estradiol level. So you can't diagnose perimenopause based on a test. You have to put the whole picture together. However, tests are going to be really important because not everybody who has brain fog, migraines, aches and pains, GI symptoms, palpitations, we can't just all say it's perimenopause. So you may need those other tests to rule out other things like thyroid conditions, but there's not a test that definitively diagnoses perimenopause. And it's important to know when we're in perimenopause because this is our opportunity. This is our chance to prepare our skin and our bodies for a smoother transition into that menopause phase. It's our opportunity to reduce what we call inflammaging, because estrogen, turns out, is anti-inflammatory. And so these are some tools. So let's get going. So again, just definitions. Perimenopause leads up to menopause. I love Dr. Rachel Rubin's analogy to the gas tank, where in perimenopause, you might be oscillating between a full estrogen tank and a low estrogen tank. And then in menopause, where it's just on empty. An average age of menopause is about 51 years old. The current definition is 12 months, consecutive months without a period. It's not the best definition. There's a lot of reasons why it's problematic. For example, if you haven't had a uterus since you were 40, that's kind of a tough definition for you to go by, but that is the definition that at this point we have. So let's talk about this not feeling like myself, because this is such a universal experience for women as we enter the perimenopause phase. The diagram that you see has the little blue dots on it. Those little blue dots represent estrogen receptors. Receptors are the receivers for different signalers, and in this case, estrogen hormone. And they are located on every single cell of every organ system in your body. So there is not a part of your body that isn't impacted by estrogen. So when you start to lose estrogen, you are going to have every part of your body potentially experience changes because of that. Some of you lucky ones will not, but others may find that it's hitting everything. So in the reproductive system, we get irregular periods, decreased fertility, a lot of vaginal dryness and irritation, genitourinary symptom of menopause, a big problem. It affects our brain, mood swings, brain fog, headaches. Those hot flashes is actually a central nervous system mediated event. Night sweats. We have musculoskeletal issues. We have joint and muscle pains. There's a lot of misdiagnosed or incorrectly diagnosed fibromyalgia in perimenopause because that's just what they decide to call it. There's increased osteoporosis and bone and muscle mass loss, so that's important. Women get heart palpitations in perimenopause. Skin and hair, we'll really take a deep dive into that. Start to change with dullness, dryness, thinness, bruising, thinning hair, acne breakouts, facial hair, and then other symptoms. It's just the list goes on. So I've taken not feeling like myself and adapted it to more of what I hear on a regular basis, which is not looking like myself. And sure, when you wake up and suddenly you're noticing you're bruising more easily and your skin is really dry and irritated, the skincare regimen that's worked great for you for the last decade is now making you feel like a snake and you're peeling. You feel like you have jowls overnight or your neck is starting to age. The skin is really thin, especially on the hands. Rosacea is popping up, acne's new, while at the same time you have a mustache and you're getting wrinkles and think you need more Botox. So this is the not looking like myself. You start to not recognize the face in the mirror, and you start to not recognize the way you need to take care of your skin, and it gets confusing and stressful. Okay, so the first thing I'm going to do is our product giveaway. This is just a great age renewal kit. This is a product with hyaluronic acid in it that will really help to rehydrate your skin, but also deliver some important anti-aging peptides into your skin. And it's appropriate for twice a day use. The lucky winner of this prize is Kelly O'Connor. So congratulations, Kelly. You're gonna love this. We will reach out to you at the end of the webinar and give you instructions on how to retrieve your product and exactly how to use it so you can enjoy it. So back to not looking like myself. So let's talk about how estrogen is helping our skin when we have it in its optimal state. So estrogen is stimulating your collagen and your elastin. Collagen gives our skin structure and firmness. Elastin gives our skin elasticity and stretch, the ability to rebound. Estrogen also boosts our hyaluronic acid content, which hyaluronic acid is a glycosaminoglycan, a sugar molecule that binds water. So it binds water, it pulls hydration and plumpness into the skin. Estrogen, in doing all of those things, helps us maintain our skin barrier. And you hear a lot about skin barrier and excess water loss. Once we lose sebum, oil production, as estrogen goes, once we lose that collagen and elastin and hyaluronic acid, our skin barrier suffers. And then estrogen also is critical in repair and helping stimulate new blood vessel perfusion into areas, and it helps with the wound healing and thickness. So as we age, we don't heal as well. And I've called this little published curve down at the bottom the estrogen collagen elastin curve, and I just think it's interesting to show that as your estrogen levels drop, there is a parallel decrease in your skin's collagen and elasticity. And all of that just really falls right in line with what we see clinically. And then estrogen-rich skin versus estrogen-deficient skin or hypoestrogenism in skin is just another schematic to show the difference in structures over time. So in menopausal skin changes, We have reduced systemic estrogen levels. Those levels start to decline. We then have lower local estrogen production in the skin. The skin is actually an endocrine organ that produces hormones, which is really cool. And then we have decreased expression of the estrogen receptors. If you think of estrogen as like making the phone call and the estrogen receptor picking up, well, when there's no estrogen there to call anymore, the estrogen receptors kind of get bored and they go away. So that's happening on more of a cellular level. What that translates into is that reduction of collagen and elastin, reduction in hyaluronic acid, reduction in oil production in some areas, and reduced perfusion with blood flow. And then clinically, and what we feel and see in the mirror is the wrinkling, the thinning skin, the weak skin barrier, the dryness and sagging, and the impaired mood healing. And just to show you how abruptly this is, women lose 30% of their collagen in the first 5 years of menopause and 2% per year after that. So we think about bulking up our muscle in perimenopause to store up. Ladies, we got to bulk up our collagen and our elastin too, because we want to have more of it in our stores and in our skin for when it starts to fall off. And then we can also do some things so it doesn't fall off quite that fast. I'm not going to dive into progesterone and testosterone. This is truly a whole other webinar. But as your estrogen levels do start to drop, you have this relative increase in androgen levels. And that's where we really start to see a lot of issues with hormonal acne, especially that mix of hormonal acne and dry skin. Unwanted facial hair can start to develop, and then hormone-induced female pattern hair loss. So that's that relative androgen excess that starts to uptick. But that's a whole other subject that we definitely need to get on the books for another discussion, because that's a big one in my clinic and in our lives. So when I'm approaching a patient who's in perimenopause or menopause and looking at her skin, I really have 3 primary goals. Number 1, I want to protect. I want to protect the collagen and elastin that she has. I want to protect her skin from skin cancer. I want to protect her from excessive oxidative stress and protect from water loss. So protection is at the top. Then I want to work on restoring and repairing. I want to restore some collagen and elastin, restore hydration, repair some DNA. And then we think about rebuilding. What else can we do to help build up the structure again, to rehydrate, to really put more of that healthy skin foundation back into place? So it would never be a dermatologist talk without telling you have to wear sunscreen. And I'll say it every single time. If you don't do anything else that I recommend, do this. You need daily sun protection. It's non-negotiable. It's protecting your collagen and elastin, but it's protecting you from skin cancer. And anybody who argues otherwise is full of crap. So you need to be wearing your sunscreen every day. And sunscreen is awesome. Protective clothing is important. Seek shade. Come in, see your dermatologist, get your regular skin exams, because it doesn't matter how fabulous your collagen and elastin levels are if we're having to cut 7 basal cells out of your face once a quarter. So wear your sunscreen. May need to switch up your cleanser. Even if you're breaking out in acne, this is not a time for your 12-year-old's Noxema or Seabreeze. Cut it out. This is when you need to use gentle cleansers that can have some actives, like sodium hypochlorite is a good antibacterial that won't strip your skin. I love Hydrinity Prelude's a fantastic cleanser with some mild alpha hydroxy acids. Glycolic acid is a really nice, lighter, milder option for gentle exfoliating. And just please avoid physical exfoliants. If it has jojoba beads, walnut shells, ground almonds, I mean, put that in your smoothie, maybe not the jojoba beads, but keep it off your face. They can get stuck under your eyelids and scratch your cornea, and they're just creating micro tears in your skin. So save yourself a trip to the ophthalmologist there. And then barrier rebuilding with moisturizing. So as we get older, those thin, cute little moisturizers that are, nice and silky may not do it for us anymore, and we need something thick. I'm kind of grossed out by jars that you throw your fingers in. I think they get a little gross. So I love a good pump cream, like the CeraVe moisturizing cream that you can buy at Costco. You want to get spendy? I love the Trio Luxe. It's a fabulous moisturizer. Sometimes we need even more than that. We need something with more of an ointment formulation. We call that an occlusive in the moisturizing world, and that will help keep your water in instead of escaping and getting out. Those are really awesome to use on super dry areas at night when our skin cells automatically kind of open up and release more water into the atmosphere. Keep that in. You need it. Your bedroom air, it doesn't need it. So you may need to use something a little heavier and even with a more ointment texture at bedtime. And then finally, don't forget your body. Your arms matter too. You don't want flaky, dry alligator skin, so get a good body moisturizer. I like Hydrinity Encore because I can put it on after hot yoga and still put my pants on. That's a goal for me. You can also get some great moisturizers just at the drugstore, like a bottle of Neutrogena Hydra Boost or some Aveeno Eczema Therapy. I mean, you don't have to spend a fortune, but you do need to do something. Antioxidants are really important in this space too. So vitamin C is best served topically in the morning on your skin, not in your orange juice when it comes to skin health. And it's going to help protect you from the oxidative stress from UV and from pollutants. So there are different varieties of topical vitamin C's you can put on to protect that precious collagen and elastin, help your sunscreen work better. Look for L-ascorbic acid or THD. Look for niacinamide, and then if you want to add a little supplement boost for the inside, HelioCare is a great option. But these go on in the morning before your sunscreen for better protection. Now the restore and repair bit, like yes, we know that in perimenopause, we really need to get our collagen and elastin back, and we are going to talk about topical estrogen creams. But guys, we've had this amazing collagen building powerhouse FDA approved at our disposal for years with tons of great safety data behind it. It's Retin-A, retinol, adapalene. It's available in different formulations and strengths, both prescription and over the counter. And you guys, this works. I have patients ask, but I'm in the sun all the time. I shouldn't use a retinoid. It's like, no, you're in the sun all the time. You definitely need to use a retinoid because these retinoids are going to help repair the DNA damage that all that sun exposure on your pickleball court is getting you during the day. So yes, you need to use a retinoid. You also need to wear the sunscreen. If I can refer back to that slide, that's really, really important. But this is a great way, no matter what your safety profile is with hormones and hormone therapy, retinoids are a great option for building collagen in your skin. And most people, not all, but most people can gradually tolerate a good, effective topical retinol or retinoid. Usually we start 2 to 3 times a week. We can use gentle ones and then up it as we go if we need to. Follow it with a moisturizer or precede it with a moisturizer. And just, again, make sure you're committing to that daily SPF. And we do put retinols on at bedtime. So, should you be putting topical estrogen on your face? Well, Instagram certainly says yes if you're on my phone. From companies like MyAlloy to Muesli, I am sure that there will be many coming up the pike. Topical estrogen is this new darling of the social media skincare world. So what's that about? Well, we have estrogen receptors in our skin. Specifically, we have a lot more of the estrogen receptor beta receptors in our skin. And this is good news for topical estrogen users because most of the reproductive malignancies like endometrial cancer and breast cancer are more estrogen receptor alpha based. But we do have alpha receptors in our skin. They are there, but beta is more prevalent. And the reasoning behind putting estrogen on our skin is because it produces collagen, elastin, helps reorganize elastin fibers so they function better, and hyaluronic acid and regulate healthier sebum production, which can lead to thicker, more hydrated, healthier skin. So the issue with estrogen, facial estrogen creams, is just lack of really large, robust clinical studies. It's not that there's zero. There are some. They're relatively small. I mean, we want at least over 100. These have more in like the teens and 20s. I think one of the larger ones I saw had 49 people in it. So they're smaller clinical studies, and they have generally shown efficacy for the estrogen creams and safety for the estrogen creams. But we don't have the gold standard randomized placebo-controlled trials that we would love to see for the systemic absorption of facial estrogen creams, and especially for the thickening of the endometrial lining. So just know that the data is there. It's not as good as we want it to be, but it is there. It suggests safety and efficacy. I do think there is more work to be done in this space. And so some people are putting vaginal estradiol on their skin. And what's that about? Well, vaginal estradiol at 0.01% concentration is what we call local hormone therapy. It's approved for the genitourinary syndrome of menopause to help with, itching, burning, painful sex issues in the vaginal area. And you just apply it topically. And the indication there is nightly for 2 weeks, and then 1 to 3 times a week after that. As the skin gets thicker, you need less of it, and it does work. And there's lots of data about the safety of vaginal estradiol, showing that it does not have a significant long-term impact on your estradiol levels in your bloodstream, nor does it have significant concerning thickening of your endometrial layer. So the OBGYN folks have done a phenomenal job over time with that study. And in derm, we don't have that robust data, but we do know that small amounts of the vaginal estradiol are considered safe without additional progesterone to oppose in some circumstances. There are other options though. A lot of the ones you'll see online are estriol creams. And estriol is a type of estrogen. It's actually the most prominent estrogen during pregnancy that our bodies produce. And it's actually less active than estradiol. So from a safety standpoint, theoretically, an estriol cream topically would have less risk than an estradiol cream, although it looks like the risk of putting vaginal estradiol in small areas is probably okay. But again, you have to be comfortable with that word, probably. And then there's something called methyl estradiol propanoate, or MEP cream, that's available in a pricey little product called Emipel. But intriguing because it doesn't have any potential for increasing your systemic estrogen levels. So a nice option if it makes you nervous or if you just have contraindications to anything estrogen on your skin. And I'm sorry if the estriol creams have not been showing up on your Instagram. They're 100% going to start showing up on your Instagram. All right, so before we dive into treatments to help boost your collagen and elastin and navigate perimenopause, let's give away our next freebie, which is a hydrofacial. So I love hydrofacials because it's a great way of cleansing and exfoliating your skin without irritating it. It really does a nice job of extracting. I call it the wet back for your skin because it literally sucks all of the debris out of your pores without causing any trauma. And it just gives you an instant glow. It'll brighten your skin. And then we can reinfuse it at the end with what you need, which if you're in perimenopause, one day it might be a little alpha hydroxy acid, and the next day it might need a little hydration. So we can customize it, and it's safe for all skin types with no downtime. So congratulations to Tamika Holmes. You are the winner of a hydrofacial, and we will reach out to you at the end of the webinar to get you scheduled. Congratulations, Tamika. So what about menopause hormone therapy? So there's all this rage online about putting estrogen creams on your face, and I've started putting a little estrogen cream on my face, and I kind of like it. But where's the real evidence? What's really going on with our hormones, and how could we really make some important impacts? And truly, this is where systemic hormone therapy shines. And systemic hormone therapy is going to give you relief for multiple systems experiencing symptoms of estrogen loss in your body. So from building up your bone density to prevent fractures, helping maintain muscle mass, improving your cognitive function, helping you sleep, reducing vasomotor symptoms like hot flashes and night sweat. Systemic hormone therapy can help all of these things, whereas just putting a little cream on your face or on your vagina is just going to make those areas feel better, which if that's all you need, that's okay too. But a lot of us need more, and we certainly all want to protect our bone strength and our bone health because we don't want to have a hip fracture at 65 because there's a high rate of mortality after that. So how do you get systemic hormone therapy? Well, it's a prescription, and there's different ways of doing it. There's oral estrogen, there's transdermal estrogen with patches, there's even topical estrogels, there's higher dose vaginal rings and inserts, and then even injectables. And there's different doses available and dosing regimens available, all based on your symptoms and side effects and response. Studies have shown great improvements in skin health with menopause hormone therapy, including increased collagen content, skin thickness, hydration, and elasticity, all of the things that we're looking for. We have more data here than we do for topical application. However, menopause hormone therapy is not indicated for skin issues of menopause alone. We are not prescribing it only for dry skin, wrinkles, sagging skin. However, if you're having those concerns and you're in perimenopause, there are probably other things at play, almost certainly bone density concerns that could justify it and warrant a bigger conversation with a certified expert menopause hormone therapy provider. It is also important to know, and not everyone does, that if you have a uterus and you are on systemic hormone therapy, part of your hormone therapy needs to include a progesterone to protect you from endometrial hyperplasia and endometrial cancer. So if you're on an estrogen patch and you have a uterus and you are not on progesterone in pill form, you need to call your provider. And by the way, progesterone cream does not count as progesterone sufficient to counterbalance the estrogen effect and the risk to your endometrium. So just important to know. And I've just shown below a few different, it comes in pills, it comes in rings, it comes in patches. And then the graph actually shows the improvement and restoration of collagen and elastin after being on hormone therapy. Specifically, this was thigh collagen content after hormone therapy. And this study was done back in 1985, before the world became afraid of estrogen. This is a lot of words on this slide. This is the latest highlights of the North American Menopause Society's hormone therapy position statement. And I just think it's important to note that this is a different era. This is not your mother's menopause or your aunt's menopause anymore. This is not when 2002 happened and the prescribing dropped almost to zero. This is a time when we have a much better understanding of the science and a more accurate, responsible interpretations of the Women's Health Initiative study. And it is now very accepted that hormone therapy is the most effective treatment for the vasomotor symptoms, the night sweats, the hot flashes, the genitourinary syndrome of menopause, and it has been shown to help prevent osteoporosis and fractures. So huge health benefits of this treatment in the right setting for the right patient. And you have to realize this is personalized. This is not just a one prescription fits all. You need to be seen, evaluated. You need to be reevaluated periodically to make sure that you're responding, to adjust the doses, maybe adjust the delivery mechanism, because all of those things can be really customized to each woman to meet your individual goals. The benefits outweigh the risk for most women who are younger than 60 and with 10 years of menopause onset. And there are the options of transdermal dosing routes and lower doses that get you away from that thromboembolism and stroke. The problem with estrogen pills is You swallow them and then they get metabolized by your liver, which is where it can impact your clotting and increase that risk of blood clots. So if you use the skin delivery mechanisms, you don't have that first pass metabolism through your liver and you avoid that thromboembolic risk. So this is why those are far more popular methods of delivery of hormone therapy. It highlights the concerns around compounded bioidentical hormone therapy. And I want to bring this up because this is another, in my opinion, generally money grab by providers to say, we're going to test your specific hormones and compound this dose at this compounding pharmacy that's just for you. And if you're doing it and it's working well for you, great. If you're not, I just want you to know that those compounding pharmacies are not as regulated and the dosing may not be as consistent. You may not get what you think you're getting. And there's really not a reason to do it in most cases. There's exceptions to everything. So I would stay in the FDA approved hormone therapy realm when there is an option, if you could go that direction versus something compounded. I think a lot of the compounded bioidentical is just a marketing scheme most of the time. For women who have that genitourinary syndrome of menopause, vaginal estrogen and sometimes systemic, sometimes you need both, can really help. And you can use that vaginal estrogen at any age for extended duration if needed. You don't want to lose the structural integrity of your genitalia. And yes, women are sexually active into their 60s, 70s, and 80s. And amen, that is a good thing. If you want to be sexually active, you don't want it to hurt. And those treatments are really important. And then our whole approach to breast cancer and hormones have changed. And this is a huge, huge topic. But it's no longer just you have a family history of breast cancer, so you can no longer go on estrogen. The fear mongering is not there anymore. And you can have, even if you've had breast cancer, you can have an informed conversation with your provider about the way you could still safely benefit from some forms of hormone therapy. So it may not work for everyone. It's not going to be okay for everybody, but it's not off the table for everybody. I just wanted to highlight that and bring it up. So let's talk treatments. So as a dermatologist, I love toys, and the toys I'm talking about are not vibrators. They're actually more lasers and radio frequency devices. And I love anything that can help build collagen, elastin, restore structure, and help my patients look like themselves again. One of my favorite new things to do is a radio frequency treatment called Everest. It bulk heats the tissue, does not disrupt the skin barrier at all, so there's no downtime. This is great for my more sensitive skin, maybe a little dry patients who don't want to go through a 5 to 10 day peeling process or recovery process, but who do want to build up some of that collagen. Love it in menopause, postmenopause, really love it in perimenopause. Again, you want to build your muscles up, your bone density up, let's build your collagen bank up too. So that's a great option. Microneedling, fabulous, tiny little injuries into the skin. They heal in, stimulate collagen, give you more structural support. Lasers, facials, that also helps relax a little bit. Facials are good. You need to take a minute for yourself to do some self-care. Good way to do it. Chemical peels, injectables, they're all ways, treatments that we can build a plan for you if you're interested in integrating that into your overall care plan. And I consider all of this, I call it functional aesthetics. It's making your skin look better, but it's really making your skin function better. And whether that makes it feel better because you're less itchy or it makes you feel better because you feel like you look like yourself, I think that those things really matter and are important. And I'm here to support however anyone wants to dive into any of this, even if it's just wearing your sunscreen every day. And I have to talk about skin wellness from within because this is important and it's just another area to be a savvy consumer in the menopause space. So you really don't need a lot of the branded supplements or workout programs. You just need to do some basic smart things and probably do a little bit more of them. Eat your fiber, 25 grams a day. It sounds like a lot, but you can get there if you're eating a lot of nutrient-rich foods and fiber-rich foods, and that's going to cut down on the processed crap that you're eating. So I support that. Get your protein, get your healthy fats, your omega-3s, eat your almonds, avocados, and your salmon, and drink your water. But remember, you cannot hydrate internally to repair your skin barrier externally. So water is important, water consumption is important, but it's not going to fix your dry skin. You need a moisturizer. Supplements, vitamin D all day long. We're all insufficient. Well, not all of us, but a lot of us are insufficient or deficient. And vitamin D is a hormone that's critical for the functioning of your immune system, for your bone health and bone strength. So you probably do need to supplement that. Easy test to do. Omega-3s, antioxidants, magnesium if you're having trouble sleeping. I love magnesium glycinate for this, to help ease the mind without the grogginess of prescription sleeping aids. If magnesium works for you, that might be a nice thing to try. Probiotics, our gut microbiome ages too, and actually we lose diversity in the good bacteria that are in our gut. And specifically looking for probiotics that have bifidobacterium and lactobacillus rhamnosus strains in them can be helpful. Do you need one in a pink bottle that says menopause in it? You know the answer is no. Very good. Okay, good. And then creatine to help with your muscles and to also help with your cognitive abilities. So there's some supplements to look at. But beware of money grabs. If there's a cheaper bottle that's white than the one that's pink and they have the same ingredients, just save yourself a few dollars. Lifestyle, manage your stress, whatever that looks like for you, improving your sleep, regular exercise, social connections. Ladies, we need to spend more time hanging out together. I know we have a million reasons not to, but we need to get together. We need to connect. It's good for our brains. It's good for our cortisol levels. It's good for our bodies. And then hormone health. Talk about this with somebody who knows what they're talking about. Discuss it with your gynecologist, your primary care doctor. If I'm your dermatologist, talk about it with me. Refer to the Menopause Society if you need help finding someone who's really going to engage in a meaningful conversation with you about all of this, because it's complicated and a lot of OBGYN residents did not even get this training. As a dermatologist, I got no training. I'm learning all of this on my own. I'm getting certified through the Menopause Society because I'm fascinated by this, and I think it can help so many of my patients live a better life and better skin. Fabulous OBGYN in town, Dr. Jen Williams. Just want to give her a shout out because I think she's doing something incredibly cool and important. She's opening her own menopause clinic soon in the coming weeks. So she's not open yet, but please go ahead and reach out to her because I have a feeling she is going to be busy. But she's amazing and smart, and you will love her, and she will spend the time that you need and deserve to get to the bottom of your hormone issues and help you start to really feel better again. So you can take a snapshot of this. It has a lot of products on it. It has different treatments for perimenopause and menopause to help get your skin looking as good as it possibly can. You know, I love skincare, and we sell skincare in our office, and we sell skincare products because I believe it is part of our service to you as our patients, because I don't want you going to Target and spending $350 on a bunch of snail mucin. I don't want you to do that. There are things that we could do that are better, that have more science behind them. So these are some recommendations. And as far as the topical estradiol question goes, talk to your dermatologist about it. Talk to your gynecologist about it. Don't talk to a robot doctor on Instagram about it. But let's decide together, make sure you're aware of the risks, the unknowns with it. And then if we decide to move forward, we can. But there are a lot of things that we can do and we have readily available at our fingertips. And whether you get it from me or someone else, I just want to make sure that you're getting the good stuff and not just a bunch of marketing fluff. And also know that menopause hormone therapy can help all of the above and so much more if it's appropriate for you. So with that, I would love everyone to glow forward, integrate good hormonal support into your lives. You deserve it, and the conversation is there. We're having it. Have it with the right people. Use targeted skincare that makes sense for you and your needs. Make some nutritional and lifestyle adjustments. And then if you're open to it and if budget allows, there's professional treatments that can really help accelerate your progress and get you looking more like yourself again a little bit faster. But understand the changes that are happening, understand the available strategies to help build your confidence and improve your quality of life, whether it's your skin, your bones, your muscles, your brain. We want all of you to be healthy. You spend 30% of your life post-menopause. Let's make that 30% the best yet. So our final giveaway is the swag bag with our branded Clear Aesthetics MD with a variety of lovely favorite products, a lot that I've talked about in the webinar today. And that winner is Jody McDonald. So Jody McDonald, congratulations. You're going to love it. We will reach out to you after the webinar. Plug for our facial membership. Commit to taking an hour a month to come in, get your skin taken care of. We have different facial options for what your skin needs at the time, some light chemical peels, even a new biostimulatory chemical peel that I'm loving. I did it yesterday. It doesn't make you peel. It's awesome. So we have lots of options to help you stay committed to taking care of yourself and taking care of your skin. And you can always get more information about that on our website. And if you join by Friday, you'll get your 7th month of membership free, which is just a nice little perk. And I'd also like to extend to all of you the VIP invitation to come and check us out in person. If you're patients, come see us after hours when we're letting our hair down. And if you're new to us, we'd love to meet you and show you around. So you get VIP invite to our open house on September 18th, and the VIP entry starts at 4:30. VIPs will receive a special swag bag as well as early access to all of our fabulous vendors and offerings who will be present, and that's at our office. And with that, thank you so much. We would love to talk. I would love to talk more with each and every one of you about your personal journey, share what I've learned, and we would love for you to follow us on Instagram, where we're very active and continue to educate. Thank you for sharing your time with us today. It really means the world, and we look forward to seeing you soon.